More, I came across this video that this our Nollywood actress Chacha Ike made about how pregnancy changes women. Like, I was so shocked of some kind of things that she revealed on this video, because if I had knew all those things, my dear, I would have think twice before having baby. So before you have baby, please, you should watch this video. Although the video is a little bit long, but it's worth every time that you're going to spend in watching this video. Please, if you are finished watching the video, make sure you like the video, drop your comments what you really think about this, everything that she said, and don't forget to follow the page. If you're watching from our YouTube, please subscribe to the channel, turn on the video as well, and also drop your thoughts, what you think. Thank you all so much. See you all in my next one.
Have you heard that pregnancy and childbirth triggers mental illness in women? Well, neither did I. Until recently, I was in the middle of my intellectual research on the internet, and this preparation was geared towards my public speaking engagement that was for the International Women's Day that held in Ebonyi State, that I dabbled on this jaw-dropping, paradigm-shifting information, and I was struck like, granted, as a mental health advocate that I am and a survivor of bipolar disorder, I have become familiar with the many causes of mental illnesses, ranging from factors like genetics, accident causing injury or head bump, poverty, death, drug abuse, stressful lifestyle, on it goes. How was I to know that somewhere in that mix, pregnancy and childbirth does add a little something to here? Oh, baby. Now, as shocking as this information was, I did not even have the nerves to dispute it. You know why? It's because I'm a mom. I have experienced multiple pregnancies. I have had multiple deliveries with 4 surviving children. I know beyond all forms of doubt that yes, indeed, pregnancy does trigger mental illness in women. And now that I've turned on my camera so we talk about it for a hot minute, let me start by asking you, why won't pregnancy trigger mental illness? I mean, have you seen pregnancy? Have you been pregnant before? Are you familiar with the many symptoms and complications that arise from the concept of pregnancy? Let's itemize some of them now, shall we? Whilst pregnant, there are the headaches and the waist pains, the back aches, the extreme tiredness and fatigues. There is the nausea and the vomiting, the breathlessness, the restlessness, the indigestion, the constipation, the heartburn, the mood swings, the leg cramps, the itchy skin that leads to stretch marks, the vaginal discharges, the vaginal infections, the tingling sensations or numbness on the hands. And let me add the complications like a high blood pressure, preeclampsia, gestational diabetes, preterm labor, depression and anxiety, postpartum psychosis, all of these on one woman. And it's not even as if pregnancy is a couple days program that you get in and get out. We all know it's a 9 months long activity. So for approximately 1 year, a woman will go through all of these. Oh, yes, indeed. Chances are it might get up in here. And listen, be not afraid if you just bumping into my video and you find these symptoms I just narrated to be scary. Baby, you deserve to know what you're up against before you hop in on that boat. And if you're a mom already, the details in this video will validate your feelings and possibly proffer solutions to your many confusions. Let me tell you this. It has been scientifically proven that every pregnant woman's brain volume shrinks by 60% whilst pregnant and expands between 6 months to 6 years after delivery. And this expansion is not even for everybody. Some people remain stuck and never make their way back. And this expansion is necessitated by the process of the baby getting formed. If you're going to host that baby like a bun in your oven, the things that it needs to become a human being, it will take from you. The baby will need to take oxygen, vitamins, nutrients from you to mold eye, nose, mouth, liver, lung, kidney, every body part. You're going to give it. And as you're giving it, you will face diminishing returns. It will erupt hormonal changes and imbalances that will leave your body chaotic and your mind in a hazardous form. I'm speaking from experience. I always say that what is worth doing should be done well. It was recently when I was in the United Kingdom for a couple of weeks that as I conversed with my darling friend, and she told me, you know what, Cha, I think I'm ready. I think I'm ready to have babies. And I was over the roof with excitement. I said, girl, let's have it. And then she said, yeah, we're gonna. But I just need to visit NHS and get myself checked out before I conceive. It was at that point that I learned something new. I learned from my friend that there are 3 stages to pregnancy. All right. There is the pre-pregnancy, there is the actual pregnancy known as antenatal, and there is the postpartum, which is the post-pregnant stage. I'm from Africa. Over here, we're only familiar with the middle, the second stage, antenatal. Over here, we just dabble into pregnancy. And then we wait until the belly bulges out before we can stroll into a hospital and say, okay, I'm here, check me out. So guys, it is ideal that before you get pregnant, there are thorough checks that needs to be conducted on you, where they will peek into your organs critically and analytically, finding out if you're good enough to host the baby, if your tubes are ready, if it is fit, if your blood pressure, your blood count can carry it, if there are infections that are already inherent there that will pose a risk to the baby when conceived. It is only by detection, by close scrutiny, that they will see it. That is pre-pregnancy. Now, actual pregnant being antenatal, the one that we're familiar with, yes, you know this one. You are required as a matter of priority to submit yourself to health bodies for scrutiny too, where they will check your vitals and that of the baby, where you will be questioned often, asking you how you're feeling. And please, I'm begging you, I know where I come from. We have become so accustomed to throwing around the word fine to every question asked. Listen to your body at all times because your body is steadily communicating. When you are asked, how are you? Take your time and categorize your emotion. Are you feeling tired? Are you exhausted? Are you starving? Are you restless? Are you panicking? Respond, because it is from your response that you will be attended to. Now, this antenatal stage is characterized by advices like take your vitamins, exercise, take a walk, you know the drill. But this is a very long stage because this is the stage that leads to you actually birthing the baby. And when that time comes, you would know that there are levels to this thing called pain. No matter the process with which your own baby is coming out, pain is pain, baby. And I have experienced it all. I have had to birth through the natural way, as they call it. And I still feel the excruciating pains all over again just by the mere thought of it. As they tore me up in my vagina, calling it episiotomy, I bled for